Right. Good morning, good afternoon, and good evening. For those of you who don't know me, I'm Sarah Webb. I'm the Senior Technical Officer at the Reproductive Health Supplies Coalition, where I have the opportunity to support the work that we do with the Menstrual Health Supplies workstream. Today, we're very excited to welcome several different speakers to take us through a deep dive into the menstrual health data on the LEAP report. And before we jump into our opening remarks, I just wanted to give everybody a quick orientation to Wordly, the AI software that we use for simultaneous translation into over 50 languages. If you would like to follow along in Wordly, you can use the URL that I just put in the chat. That will take you to a window where you can enter the translation and select the language that you would like to follow along in. And with that, I would like to welcome our first speaker today, Tanya Mahajan. Tanya is the co-founder of Menstrual Health Action for Impact, a strategy specialist at the PAD Project, and also the co-chair of the Menstrual Health Supplies workstream at the Reproductive Health Supplies Coalition. Tanya, I will hand it over to you.
Thank you, Sarah. Hello, everyone, and welcome to today's webinar. And I want to thank the RHSC team for having me do the opening remarks for this very interesting webinar today, where we'll be getting a deep dive into the menstrual health section of the report, which is the landscape and projection of reproductive health supply needs. Now, it's actually in its 24th year now that LEAP was started. It has been a long-standing effort of the reproductive health community, taking from the commodity gap analysis, but it was only very recently that menstrual health supplies were added to LEAP data back in 2021, when we saw the first iteration. And it has honestly been a game changer for some of us working in the menstrual health community who've been using this data for advocacy purposes. I personally have been engaged in research and advocacy related to menstrual health for the last 12 years. And 12 years ago, our discussions focused on, yes, we need to advocate for equitable access to menstrual products. We need to advocate for informed choice in menstrual health. Consumers had inequitable access. Those with fewer resources did not have access to products. We were seeing this in the field. We were seeing it in our work. And in the vacuum created by the culture of silence around menstruation, consumers in LMICs were being told that cloth is bad, pads are great, and based on this imperfect information available to them from the market, consumers were making inefficient decisions that using only a single type of product was great, even if it caused health risks, using them for longer periods than appropriate, further exacerbating some of those health risks, and disregarding options like cloth and cloth-based products that had the opportunity to increase access to menstrual products. So at that time, I think our ask was clear, which was to make an informed decision, we needed solid, robust data that reflects market realities. And it's not the data was not available. There always has been data available from private sector market research, but it was always hidden behind paywalls, and it wasn't as comprehensive as we needed for advocacy work. So around 2018, members engaged with RHSC brought this issue to the platform, and leadership and the RHSC leadership took the significant step of including menstrual health into the ongoing LEAP work. The first data set came out in 2021, and now we have the second iteration available. LEAP, for the very first time, gave us data on global and country levels, pulling from a variety of data sources on the size of the market. So what's the comprehensive number of menstruators globally and at different country levels? What are they actually using between purpose-made products and non-purpose-made products? And what is the cost of different type of products, and what are the potential cost savings? And we've actually been able to use some of this data for advocacy in different contexts. I shared some of these examples in detail during the LEAP launch webinar, but I wanted to highlight them today to also ask you to reflect on your use cases. The first was in the context of the ongoing work with the International Standards Organization on creating menstrual product standards, to really make the case for why LMIC participation is necessary in the standards creation process. And as part of creating the strategic business plan for the ISO committee, we were able to quantitatively use the LEAP data to make that case by showing that the target market in LMICs is significant because we have that data from LEAP, but also showing the growth potential. This data has also showed us that there's still lagging access to purpose-made products in lower and lower middle income countries compared to higher income countries, and seeing the comparatively high partial use of single-use products and the cost savings data, we are also able to advocate for informed choice now. So I would like to invite you to share your use cases in the chat box as we go through this work. I'll pass it over to Nicole. Sorry. Sorry. I'll pass it over now to Nicole Bellows from Avenir Health, Michelle Weinberger from Avenir Health, to take us through the data in detail and how we can use this for advocacy research and other use cases.
Great. Thanks so much, Tanya. And it's always wonderful to hear these examples that you and others in the community have of using LEAP data to inform advocacy and really see some results, which is always exciting. So over the next hour, we are gonna give a just brief overall introduction to LEAP. We're gonna share some key results from the menstrual health section. We're going to talk about some wide variation that we see across income groups, regions, and countries. We're going to look into 2 new data explorer tools that were just launched. And then we're going to save some time at the end for Q&A and discussion. Throughout this morning's webinar, we're going to use Mentimeter to be able to get some engagement from the group. So in just a moment, we'll ask you all to log on so that we can start that. In addition to sharing your use cases in the chat, if you have any questions or comments, please drop those in the chat as we go, and we'll be collecting those and make sure that we have time to come back to them during our Q&A at the end. So with that, let's talk about LEAP. So before we get into what LEAP is, we thought it would be useful to just kind of take a temperature check and see to what degree those folks with us today have used LEAP. So if you log on to Menti using the code you see at the top there, you can answer this question, which has 3 choices about how familiar you are with the menstrual health part of LEAP. So we'll just give a minute or 2 to get some more votes. I see lots of people who have used it, which is wonderful. And for those who are not or only somewhat familiar with LEAP, we hope that today will help give you more of an introduction to it. Great. So LEAP brings together 4 different stories looking at contraception, menstrual health, abortion and PAC, and maternal health. So in its origins, LEAP was really just focused on contraception. There is a long-standing commodity gap analysis that actually slightly predated the formation of the Reproductive Health Supplies Coalition, and had expanded over the years to kind of look more in depth into contraception. But as Tanya alluded to in her opening, you know, the RHSC's remit and membership looks beyond just contraception. And there is a desire to expand what was then the CGA and then became LEAP to look into supply needs across a woman's reproductive health needs. And so in 2021, we took that first step to build out a methodology to estimate use and costs of supplies for these 3 new health areas. And then again in 2024, we updated this analysis, kind of bringing in new data sources, consulting with members and other users of the data to see where we could update things, kind of get more granularity into our analysis. The LEAP report presents each of these 4 health areas separately. So you'll see there's essentially a suite of reports across them. And while the results are separate across the health areas, in the background, we capture the dynamics that happen between these. So for example, as contraceptive use increases, that decreases the number of pregnancies, which impacts the need for abortion and PAC and maternal health supplies. And similarly, contraceptive use also influences maternal health with an increase in hormonal contraception influencing a woman's menstrual health needs by reducing, for example, with implants, kind of reducing the need for menstrual health products. And there's also a dynamic between pregnancies and menstrual health needs. So as women are spending less time pregnant or postpartum, as contraceptive use increases, that also influences their menstrual health needs. So while we look at these separately, there are these interconnections happening in the background that account for all those different dynamics. Across the 4 health areas, we present similar results. First, we look at the people needing and using the key reproductive health supplies. We look at the quantities of drugs and supplies that are used, and then we estimate the costs of those drugs and supplies. We do this first for a current landscape, which is built at 2023 in this report, and project forward 3 different scenarios of changes ahead, looking out to an endpoint of 2035. Our analysis covers 132 low and middle income countries. We present results by country, and we also often aggregate them by GNI income group. So that's low income, lower middle income, and upper middle income countries. We use a large range of different data sources for LEAP, as you can see here. We take existing UN population projections, lots of information from household surveys, lots of price and sale volume data from different sources, as well as other research to bring together this comprehensive picture of use across the 4 health areas. All of the data sources in yellow indicate things that were updated in the 2024 LEAP report. A few notable data changes for menstrual health is that we were able to leverage new private sector data from online pharmacy searches to get additional granularity into the price of menstrual health products. And we're also able to add survey data for 18 more countries, bringing us to a total of 54 countries with country-specific data. And that was really a step change this year, largely thanks to mixed surveys that already had these questions and DHS surveys that started to integrate these questions. And so we have a much more complete picture this year of what is happening in terms of use of menstrual health products. So for those who were familiar with the work in 2021, just a few other notes on things that were updated or changed. We expanded our timeline out to 2035. As I already mentioned, we have this new data included, so have a lot more countries with country-specific information, which makes our estimates a lot stronger. So we have less reliance on regional averages for those remaining countries. We also provided more visibility into full versus partial use of single-use products, and we'll get into this a little bit more. This was previously accounted for sort of in the background of our analysis in terms of quantities and costs, but we didn't actually show these results. And so now we're showing these results so that we can talk about, and I think it's a useful advocacy message around where we see a lot of partial use and what would be needed to help women have access to a full range of products to meet their needs. We also updated some assumptions on full and partial use and unit prices based on new data. We've also incorporated a mixed use category into our future scenarios, which allows us to account for this idea that women in the future might use a combination of single use and reusable products, which is something we heard from feedback with this community and others and kind of see through research, and so wanted to be able to capture that idea that it's not just sort of a mutually exclusive, you're using reusables or you're using single-use products. And finally, we made some adjustments to our future scenarios to try to make sure that we were being feasible in the changes that we were projecting based on feedback from members of the coalition and others in this space. We also changed the structure of LEAP to try to make the results more accessible. In this year's LEAP report, there are 2 main reports. First, there is an overview report. This is a dynamic report that is updated for any selected country or region. So if the starting report is for all low and middle income countries, but you can pick a single country or a single region, and the report will update to reflect that. And the second is a global GNI comparison report, which is looking at differences between low, lower middle, and upper middle income countries. We also have 2 new data explorer tools that Nicole is going to walk us through later in this webinar. And for those who just want the numbers, you can get those through annex tables or just downloading an Excel with all of the data from the report. With that, I will pass to Nicole to take us through some key results.
Great, thanks, Michelle. So I'm going to walk through some high-level results, that some of which were presented in the earlier webinar, for those who were unable to join that webinar. So across all low and middle income countries, there's an estimated 1.72 billion menstruators in 2023. We segmented these menstruators by their use of what we call purpose-made menstrual health products. And that includes single-use products, such as disposable pads and tampons, and then the purpose-made reusable products. So these are reusable menstrual pads and underwear that were made specifically for that purpose, as well as menstrual cups. So we realized that many menstruators use non-purpose-made products, which are captured in the gray segment there. This includes household cloth, as well as other types of products. They're not included in our quantification because of some data challenges around that. In total, across all lower middle income countries, there's an estimated 78% of menstruators use some form of purpose-made products. Most of this is single-use products. And then we further segment those who are using single-use products into two groups. Those whose needs are being fully met, so we call them full use, as Michelle mentioned earlier, and those who are using fewer products than they actually need, which is partial use. And that is the lighter green box in this graph. And an example might be somebody who, cycle would ideally require 12 single-use products, but they are getting by with just 6. The estimated annual costs of purpose-made menstrual health products comes to $28.8 billion in 2023. This is across all lower and middle income countries. And at present, approximately 99% of these costs are attributable to those single-use products. And this is due to the low number of menstruators using purpose-made reusable products at present, according to the survey data available, and also the lower annual unit costs of those using reusable products for those who are using reusables. So in looking ahead to 2035, we looked at 3 different scenarios. Scenario 1 is what we call maintained product use. So here's where, when we project into the future, we're not expecting any changes in the proportion of purpose-made product use over time, but we do factor in changes in the demographics, as well as those relationships with contraceptive use and fertility rates and how those impact the need for menstrual health products. Our second scenario is what we call the increased single-use scenario, which shows an increased access to single-use products. In order to do this, we match the proportion of menstruators exclusively using single-use products in each income group, and then said by the time we get to 2035, we're hoping that they can be achieving those use levels of the next highest income group up within the same geographic region. So also in this scenario, we have partial use halving by 2035. So a reduction in that partial use as well as an increase in single use overall. Finally, our shift in scenario 3 has the same dynamics of what's going on in our scenario 2, where we increase single use, so that increase in access, but we're also adding in a dimension of a shift towards reusable products, where 10% of previously single-use product menstruators are expected to be exclusively using reusable products by 2035, and another 20% are using reusables as a complement to single-use products. So as Michelle mentioned this, we kind of calling these mixed users in this particular model. So here we see that the estimated proportion of menstruators using purpose-made products in 2035 increases to 93% in scenarios 2 and 3. Scenario 2 shows that across all lower middle income countries, the proportion of menstruators that would be using single-use products is 88% compared to 65% in scenario 1, with an additional 5% reusing reusable products. In scenario 3, we see this substantial shift of 15% of menstruators using reusables, and another 16 using a mix of single-use and reusables by 2035. So we take our existing data that we have, and we match it to these different scenario projections ahead to get these results. While overall access to menstrual health products does not increase when moving from scenario 2 to 3, there's an interesting cost and environmental implications. So here you can see the costs for single-use products, that they increase substantially when we're moving from scenario 1, which is the maintained product use scenario in orange, to the increased single-use scenario 2 that's in green. But that these shift costs then are offset with the shift to reusables in scenario 3, which is shown in purple. And on that single use to the left graph, you can't really see the purple line because it's hiding behind the orange line. So of course, there's a corresponding increase in reusable costs in scenario 3. But these, because the annual cost for reusable is lower than for single-use products, this increase is not nearly as big as the cost savings around single use. And when we look across all lower and middle income countries, the cumulative total costs from 2023 to 2035, we have a savings of $35 billion in scenario 3 when you compare it to scenario 2. So you can increase that access and offset some of the costs at that expense. And then this, of course, also has environmental implications. With 52 billion fewer single-use products that need to be disposed of under the shift when we shift to that reusables scenario. So here's another Menti. People if you're still logged on or if you need to go back, the code is here, the 54430991. But in terms of understanding these elements around reusables, we wanted to kind of get people's thoughts on how important are the factors related to increased access to reusable menstrual health products. So you should be on your phone or on your laptop, be able to kind of use the little slider bars to indicate what level of importance you think these elements have. Let's see if people are able to complete that. Just give it a minute and see where people are falling in. So with the responses thus far, we're seeing a mix, but a lot of people talk about how the importance of choice. And we talk a lot about this in contraception and increasing choice among those who are faced with different options and making sure that they can select the method that is best for them. And I think that's definitely true in menstrual health as well. And that's being reflected in some of these responses. And then also then this idea of cost savings and environmental impact is also quite important. So we can share some of these results later. And we'll give it just another minute as I see some more responses coming through. Okay, I'm going to turn this back over to Michelle to talk about variation by income.
Great, thanks, Nicole. So the results that Nicole just showed are the aggregate totals for all low and middle income countries. And while these are useful to paint a kind of global picture of what the market looks like, they hide a lot of variation across income groups, regions, and countries. And so in this section, we're going to start to look into some of this variation. So first, we'll start looking across income groups. And this graph shows the relative distribution of purpose-made product use within low, lower middle, and upper middle income countries. We can see that based on available data, there's sort of this upward trend with higher levels of purpose-made product use as we go up to higher income groups. So starting at only 35% of menstruators in low income countries using purpose-made products, 72% in lower middle, and all the way up to 95% in upper middle income countries. We also see that partial use of single-use products, shown in the light green section of the graph, is also higher in low and lower middle income countries compared to upper middle income countries, but doesn't fully disappear in upper middle income countries. So even in those countries, we see a little bit of that partial use. And again, just as a reminder, this is an estimate of women who are using single-use products, but have an insufficient amount of them. They're not able to fully meet their menstrual health needs with the products that they have available or are able to afford. We also see large differences by region. So here we're looking at results for 4 select regions. We can see that use is much lower in sub-Saharan Africa at 52% compared to South Asia, East Asia and Pacific, and Latin America and Caribbean. And while looking at these patterns across income groups and regions is helpful to kind of understand the dynamics of the menstrual health markets in different places, we also want to remind everyone that even within a region, we still see a lot of variation across countries. So on this slide, we're looking at 3 lower middle income countries in sub-Saharan Africa, right? So these are 3 countries that share both the same kind of regional classification and the same income group classification. But we see that despite kind of sitting in the same region and sitting in the same income group, we see wide differences in their purpose-made product use, ranging from just 52% in Cote d'Ivoire to nearly 70% in Nigeria to over 90% in Lesotho. So again, just a reminder that, you know, these aggregate totals are useful, but depending on where your advocacy messages are being targeted, whether it's a more global message or a more country-driven message, that it's useful to go into both those kind of more aggregated regional results in LEAP, as well as to dive more into this country variation. And we'll talk a little bit more about the tools that help you do that a bit later. So going back to Menti again, we see this really wide variation. And so just wanted to get some thoughts from the group on why we might see such wide variation. This is just an open response question, and you should be able to submit multiple responses. So if you have different ideas, you can type those in separately. So again, if you open up Menti or still have it open, it should advance to this and be able to put in some responses. So we'll give a couple of minutes. Great, lots of wonderful ideas coming in. So you see policy differences, disposable incomes, around affordability, around market development, urban, rural. Yeah, that's a great point. And we didn't get into this, but within the kind of background of the methodology for LEAP for menstrual health is everything is segmented out by urban and rural, because we do see such stark differences in levels of use in urban and rural areas. So distribution, affordability. Great. So these are some of the things we had been thinking about coming into this, and I think this is well covered in what we heard from you all, plus some other things as well. All right, there's a whole lot of different things influencing the different patterns that we see. One other one we wanted to note is also just data quality. The questions about asking women about their use of menstrual health products are fairly new. They've been in mix for a bit longer. There are some recent questions added into DHS. The way these questions are asked vary some across surveys, which can sometimes make it hard to interpret, especially for that kind of use of things that we might not consider a purpose-made product, like cloth and cotton wool and different things. And so in addition to all of the differences already talked about, we just also wanted to note that, you know, there may be some kind of data interpretation differences feeding into some of what we're seeing as well. And we hope that as this is an area that kind of grows and as our questions and surveys become more standardized, that we're going to be able to get to a point where we have a lot more comparable data across countries and can feel more confident in how we are able to interpret the data that we have about what products women are using. So the previous slides, we were looking at the distribution of product use, but we also see large differences if we look at the absolute number of menstruators, as well as the cost of purpose-made menstrual health products across income groups. The differences in the number of menstruators are driven by demographic differences among the countries that fall into income groups. And the differences in costs are influenced by these demographics, along with the type of methods being used, the dynamics of full and partial use, as well as the unit costs of the products. So we see here that upper middle income countries on the first graph on the left account for about 41% of menstruators, but they account for a larger share of costs, nearly 60% of costs. And this is driven by a higher unit cost and a lower level of partial use. So the kind of cost per menstruator is higher in upper middle income countries. And on our next slide, we can just look into this in a little bit more detail. So this table is showing regional differences in unit costs. The first section of the table in white is looking at the cost of products. So for example, the cost of one pad. We didn't have sufficient data on reusable pads to incorporate country and regional variations, so we're just using a global price assumption for pads. But for single-use products and reusable cups, we've incorporated country and regional data to capture price differences. So you can see here, we found that generally in Latin America and the Caribbean, we saw the highest prices for both single-use products and reusable cups. And in South Asia, generally found the lowest for both of those methods. The second set of results in this table, highlighted in green, show that annualized cost per menstruator. So this is saying, what does it cost over a year for a menstruator to use to get all of the products that they need? This accounts for different things. First, it accounts for the use of multiple single-use products over the course of a year, factoring in the kind of reduced need for those who have their needs only partially filled, those who are pregnant or postpartum, or who have reduced needs due to use of hormonal contraceptives. It also accounts for the fact that reusable pads and cups last multiple years, and so don't need to be purchased every year. And so we can see that although a single-use product is quite cheap, that over the course of a year that this can add up to be quite a lot. And again, just a reminder that these are lower in a lot of places because of that partial use. And if women were using the full amount of single-use products that they needed to fully meet their needs, that these costs would be much higher in some places. And so here we can see, as Nicole talked about before, about kind of the cost savings that we saw in those earlier graphs of that shift to reusables is really because if we look at this annualized cost, but there's a pretty significant difference between the annual cost of using single-use products exclusively versus using reusable products. So ranging from kind of $2 to $4 for reusable products versus $20 to $40 for single-use products.
I'm going to take it from here and talk about some of our new Data Explorer tools. There are two new tools that have been released for LEAP 2024. We have the Country Comparison Data Explorer that provides estimates of the number of menstruators, the products they use, and the related costs for countries within the selected region. And we also have the Product Deep Dive Data Explorer that provides a detailed picture of the use, quantities, and costs for the different selected products. So starting with the Country Comparison Explorer, you can use the drop-down list to select the group of interest. This can be based on the income groups or the geographic regions, as we've explored earlier, or it could also be based on specific donor priority countries. So in this example, we've selected the countries that are part of the Ouagadougou Partnership, so you can see how that this tool works in that with that selection. So it'll align all the different countries that are in the group that you've selected, and you can see how they compare and what the variation is within those groups. And you can interact with the figure to explore the data in different ways. For an example, here's a graphic on the use of menstrual health products that's showing the number of menstruators and the different use categories by country. And this is, you can see the greatest number of menstruators are in Cote d'Ivoire among this partnership. And looking right now, we're looking at the absolutes of the numbers. But if we toggle to the relative, we're going to see this as a percentage and a proportion on how purpose-made, reusable and single use is how that varies. So here you can see that while Cote d'Ivoire might have the greatest number of menstruators, we're seeing higher levels of use in Mauritania and Guinea and Senegal. And this is again looking at the number of menstruators, but you can also toggle to see how this looks for costs as well. Here, shifting to costs, you can see the 2023 estimated costs in absolute terms. And this information can also be downloaded as a CSV file for the data, or if you want the image itself as a PNG file. When looking at the projected changes, one can select the indicator, the product, and the scenario to see what projected changes we'll have from our time frame of 2023 to 2035. So this graph reflects the estimated changes in costs of single-use products under scenario 2, which is our increased single use. And you can see where the big jumps in costs will occur, particularly with countries that have a lot of menstruators and maybe a lower initial use. So that big increase that they have in by 2035 is reflected in the costs here. Another figure compares the different scenarios in 2035. So here you can see how the costs of single-use products differ by the 3 countries in each scenario. And for the reasons we've already discussed, these are typically lowest under scenario 1, which is maintain product use, and highest under scenario 2, where we increase the access to single use. And then typically scenario 3, the purple dot, falls in between because that's reflecting the same level of access, but with a shift towards more reusables and the potential offsetting of costs that can occur. So shifting to the product deep dive tool, this lets you focus on a particular product among single use, which includes both pads and tampons, and then reusable pads and menstrual cups. So here you can see the future estimated number of products needed over time under these 3 different scenarios. One interesting result in this graph is that among upper middle income countries, there's expected to be fewer single-use products under scenario 3 when we shift to reusables compared to even scenario 1, maintain product use. And this is because product use is already very high in these upper middle income countries, and also the population of menstruators is declining in some countries. So even with greater access, this shift to reusables as well as the population dynamics can result in a decrease in the number of needed products. And before, as we discussed, that has like cost and as well as environmental implications. When looking at reusable pads, and with this product deep dive tool, you can see that most menstruators here are that are using reusable pads are currently estimated to be living in lower middle income countries. And you can also look at the number of menstruators, quantities, and costs under different scenarios and at different timeframes. So here we're looking at the quantities of reusable pads estimated to be needed from 2023 to 2035. And as you can see here, China and India really dominate this market due to their larger population size. So as you use this tool, you can also opt to exclude China and India to see what this landscape looks without considering these countries, since they tend to kind of dominate the graphs. So here's an example of the same data, but the scale changes, and now you can see a little bit more nuance between the other countries. So by kind of toggling between these different settings, you can, gather other different implications and insights. So, as we kind of end this portion of the webinar, one thing we really want to ensure is that the data underlying all these different tools and graphics are accessible to users. The data on the current status and future projections are available for all low and middle income countries, both individually and collectively, as well as looking at them grouped by their respective regions, income groups, and donor priority groups. And as Michelle previously mentioned, all the graphs can be downloaded as PNG files, the underlying data of those graphs as CSV files, as well as looking at the key annex tables to provide a summary of main results for any selected country or region. And then finally, for advanced users who want to play around with the entire data set, that can also be downloaded on the website for further analysis. So I think in the past, we've heard like, oh, the report's great. I wish you had it for Kenya specifically, and we do, it's there. You just need to, go and use those drop-down menus to find that data specifically for the country or region you're looking at. So I think we wanted to end it with one last Menti question before we open up to the Q&A. It's just to get a sense of what are some ways you envision using the LEAP data. I think that some of this has probably been in the chat based on Tanya's great prompt at the beginning. But if people have a second to kind of give us a sense of how they envision using this data, that would be really helpful for us as we think about future iterations. Great. So a lot of advocacy, that's how we also envision the tool to be important for that, and understanding these other patterns of use. Wonderful. Thank you for all your responses. I think we'll pause here now and go to questions and answers. So I can stop sharing my screen so everyone can see each other, and we'll go to the Q&A.
Awesome. Thank you so much, Nicole. So as people have questions, please do put them in the chat. We have about 15 minutes to take questions from the group. And so there's a couple that came in while Michelle and Nicole were presenting. So I'll go ahead and start with those. And as we get others, we'll refer them to the group. So one of the questions that came in was around the menstrual cup. And the question was, do you know how much of the cup price is subsidized? Curious that it is so low in sub-Saharan Africa and South Asia.
Yeah, that's a great question. The price information is something that's like new and evolving for us. And as Michelle mentioned, we updated the prices that we use for this LEAP 2024 report, doing a pretty thorough review of different online pharmacies across the different countries. And that's where we gathered that data. So to the extent that the subsidies are, making their way into the online pharmacy prices, I'm not 100% sure, but I think, just due to like local manufacturing and, is a big driver in those. I think we're hoping to get, better data on prices as time goes by. But, this is sort of what we're working with at present. But I think that variability in cups was really striking. As well. I don't know, Michelle, if you have more to comment on.
No, but I saw, Tanya, you had a response in the chat, so I don't know if you wanted to add anything.
Yeah, no, just one thought that I know that in South Asia, and particularly in India, there's a lot of local manufacturing, given that, there's a robust medical devices industry. So given that the prices in the South Asian region are low and can be expected, but I'm actually quite surprised by the Sub-Saharan Africa data myself, and it's worth looking into. That's the why there is interesting. I don't know.
I mean, I would note especially, that market is very, very small. And so it might just be that there's like a handful of, maybe NGO supported or other subsidized groups that are kind of getting cups into those markets at that lower price point. But I'd say, it seems like a pretty undeveloped market at this point. So it would not generalize too much about what we were able to find in terms of those costs.
Awesome. Thank you all. A second question, and I know, Michelle, you've already added a response to this, but there's a question around analyzing the environmental impact and some excitement around seeing that as a factor and a recognition that that analysis is likely challenging. Is there anything that you would add to your response on that, Michelle?
Yeah, I mean, I think there's probably further steps you could, take to quantify, so we're just taking a kind of first step, which feels very within the scope of LEAP to just say, how many fewer single-use products are needed in scenario 3, where we have that shift to reusables as compared to scenario 2. It would be interesting, and we can look to the literature to see what others have done to think about. There's probably ways to quantify that more. So then what does that fewer number of pads actually mean in terms of some of those environmental impacts? So we have not taken that step within LEAP itself, but it's definitely something that could be explored further to either turn that into an economic cost or think about other ways to kind of think about what that means more.
Awesome.
Yeah.
Thanks, Michelle. Yeah, Tanya, go ahead.
Just a note on that, and Nancy actually led a project with Path in 2012 that developed a waste loading model that linked different products to the quantities of waste. So LEAP might consider, adding that as a data source in the next iteration.
Awesome. Thanks, Tanya. So Michelle, another question that we had, Michelle or Nicole, this is open to both of you, was kind of what you see as the biggest data gaps for the menstrual health results. I know we talked a bit at the beginning about some of the gaps in the menstrual health landscape and how LEAP has helped to fill some of those, but what would you see as some of the biggest data gaps for these results within the report specifically?
I think I'll start. Michelle can add in. I think the issue around the pricing data is one where we would love to see to really be able to refine and do a better job with like market sizing and estimates. So not just pricing data, but also sort of what is the willingness to pay for different people, for different types of products, because I think that element would help us better understand and make better projections about where this market could go and where there are potential opportunities and areas particularly ripe for investments in menstrual health.
Awesome. Thanks, Nicole. Michelle, anything you would add there?
Maybe just building on a note from earlier, it's great that menstrual health is being included in so many more household surveys, and that's giving us a lot more data, but I think there's still work to be done around standardization of those questions to ensure that the information we're getting from those surveys is really telling us what we think it's telling us and is telling us information that's comparable across countries so that we can make the best use of it.
Yeah, absolutely. So a good nod to some continued advocacy for better data quality, in addition to just spreading the access to data. We have another question that just came up in the chat about whether you can speak to the availability of historical trend data.
In terms of the trends on menstrual health product use, that is not something that we have been privy to, and that's partly because this topic has been largely ignored in many household surveys until now. So part of it is very exciting that we have this data, and sometimes we'll have one or two different data points over time, but for the most part, the long trend data, like we have with contraception and in other health areas, has not been readily available across multiple countries. So I think that's something that we're hoping to look at more in the future and try to explore certain case studies where that might be available.
Awesome. Thanks, Nicole. Michelle, anything you want to add before we move to the next question? Perfect. So the next question is from Tanya, and she's asking, how comparable is data at the country level on different supply categories? For example, menstrual health supplies in correlation with contraceptive use data.
I can speak to that initially. We've looked at that. That was an interesting question and hypothesis that where you see greater maybe contraceptive supply use. You might see greater menstrual health use. And when we explored that, we found really, like, based on the data of the 54 countries we had and their contraceptive prevalence, a pretty weak linear relationship. So there is a correlation there, but for those of you who get into statistics, it's sort of like a 0.3 correlation coefficient. So not a real strong, compelling case. But that being said, the data are not set up to explore that relationship. We just sort of, kind of did it on the back end. And because we have some data questions, data concerns around making big conclusions around those types of relationships, we are withholding our judgment on what that relationship looks like, and hoping better data in the future will unveil that.
Awesome. Thank you so much, Nicole. Another question that we had was sort of around how menstrual health results compare to the other health areas in LEAP. So anything that you would kind of call out to the comparability across the other commodity groups?
Yeah, I'll say, I think it was really interesting as we made this expansion of LEAP from contraception to these other health areas, because they're all really, really different markets, right? So contraception, you have a kind of large role of donor funding, but also a fairly significant private market. So you sort of have this blended market, and in the donors and kind of public sector side of things, you have very centralized procurement. You have only a handful of manufacturers for a lot of the products. And I would say menstrual health is sort of on the extreme opposite of that, right? Is that we have a almost fully private market. We found a little bit of evidence of maybe some like small public sector procurement happening around like schools or around certain settings, but nothing large scale. And you have just a huge range of manufacturing, a lot of local manufacturing, there's a lot more players in the field. And then I would say, the maternal health and abortion and PAC are a little bit in the middle of that, with, maternal health, largely procurement is happening by governments, not donors. And so we have a lot less visibility into that than we do for others. And with abortion and PAC, a kind of mix of both public and private, but because it's more of a medical product rather than the menstrual health products, you have a little bit more centralization in terms of the manufacturing. And so, yeah, I would say they're all very, very different landscapes with different challenges, both in terms of, how we size the markets and understand the markets, but also just very different thinking from an advocacy perspective, right? The way that you kind of address gaps is going to look very different in each of these markets, just because the solutions are really different given the diversity of the markets.
Awesome. Thanks, Michelle. Nicole, anything you would want to add there?
No, nothing to add. I really focus on the menstrual health and then have just been a participant in some of the other webinars and health areas. And so it's great to kind of see the different issues that come up and we try to, take the report and use the same type of approach of, looking at different scenarios. But there are a lot of really unique aspects across the different health areas. So it's been interesting to learn on my end.
Awesome. Thanks so much, Nicole. So we have a couple minutes remaining, and I'm not seeing any other questions in the chat. So I wanted to invite each of our speakers to leave us with some closing thoughts or a call to action, if you will. So Nicole, Michelle, and Tanya, when you think about the LEAP report and kind of the use of the LEAP report for menstrual health, and knowing that on the line today, we have a very strong mix of researchers, advocates, people working for NGOs, a couple people working kind of in governments at the Ministry of Health level or in other government programs. What might be something that you hope people will do either with this report or just kind of with the menstrual health data landscape? So Michelle, I will hand it to you first. Put you on the spot.
Sure. Yeah, I mean, I think that while we had some, information about what use looked like, that before LEAP, it was never kind of collated together in this way. And so I think there's just still a lot of learning that can be had to really socialize the scope of use and the scope of need across different countries. And so I hope that LEAP helps just sort of build that foundation to some of these conversations, whether they're happening at a global level or a regional level or a country level, to just be able to understand where the needs are right now, so that we can start to talk about what is needed to shift those needs in the future.
Awesome. Thanks, Michelle. Nicole, I will hand it to you next.
Sure. I have similar thoughts to Michelle. I think the way I envision people using LEAP is, especially if they have a particular country or region that they're looking in, to really take a look at what is going on in their country and how does that compare with their neighbors? How does it compare with people in the same and other income groups, and think of it sort of, what is going on in our environment and how can we advocate to kind of help, if we're behind or if we have less access to these products, how can we make some improvements and think about how to bring advocacy forward for increased investments in menstrual health.
Awesome. Thanks, Nicole. And last, but certainly not least, Tanya, any thoughts from you on a call to action for those on the line today?
Yeah, sure. I think I'm really looking forward to exploring the data for a few different advocacy objectives, actually. One being the Global South sort of cross-learning agenda. We are trying to work on where can we learn from different markets and how can markets learn from each other. So looking at different countries and regions and geographies and how they compare with each other in terms of these trends, I think that's a very important resource in that advocacy piece. And secondly, also, I think this is the first time, while Nicole was gracious enough to respond to my request for looking at the correlation between contraception and MH use. But I think this is the first time we are seeing this level of data available for a certain country across different health areas. And so looking at the reproductive life cycle of a woman and bringing menstrual health as an integrating factor, how can we look at some of these databases, bring them together and tell a story at a country level? So looking forward to doing that.
Awesome. Thank you so much, Tanya. And that brings us almost to the very end of our webinar. So I would encourage anyone who's not already part of the menstrual health supplies workstream to join us. I just put a link in the chat where you can do that. And we will continue to think about some of these calls to action that Nicole, Michelle, and Tanya just put out there, ways that we can improve the report, ways that we can think about how to use the report, and really use it as an important tool for advocacy and having better visibility into access of menstrual health supplies globally. So with that, I want to thank all three of our speakers today. Thank you, Nicole, Michelle, and Tanya, for your time. And to all of our participants for attending, for their great questions, and for the ongoing work that we know all of you are doing to expand access to menstrual health supplies globally. So thank you all and have a great rest of the day.
Great, thank you.
Thanks.
Thanks, everyone.